This is Don DeBar, and I'm standing in front of the Target Center in beautiful downtown Minneapolis, Minnesota, which tomorrow will be the site of Ron Paul's alternate convention. I spoke with Rebecca Trotsky-Sir, who's a fourth-year medical student here at the University of Minnesota. She is also one of the organizers of a group of street medics who will be available to protesters should they require medical services. Could you tell us why you thought there was a need for street medics for the protesters?
So in Minneapolis and St. Paul, we have a really good infrastructure for healthcare, but with the coming of thousands of protesters that we expect, I think our services are going to be inundated with people needing trauma care, perhaps from instances of brutality or injury, as well as pepper spray decontamination from various riot control agents or crowd control agents. We're also just concerned that a lot of people don't have access to healthcare these days, so we're providing basic ambulatory care at our wellness center. Anything from I forgot my medication or I need to talk to somebody about some problem I'm having, and we have a pretty strong referral system to social service agencies around the area, as well as having a lot of experienced providers coming and sharing their services. So
what have you heard about so far in terms of instances of with the police?
Right now, the police have been engaged in a strategy of preemptive arrests of organizers and social justice activists in Minneapolis. A lot of fear has been going around our community. Various houses have been raided. We know of at least 4 to 5 house raids. And a lot of activists are just fearful about being arrested, being pulled off the street. So activists are being afraid of being arrested, being pulled off the street, being taken at a park like one of our community organizers was. A lot of the convergence and meeting spaces have been particularly targeted so that people have difficulty networking with each other and exchanging information. We had fear yesterday that our wellness center was going to be raided. However, that has been unfounded. We have a lot of security, and we were very watchful of that area. We had to cancel one of our health trainings that was being put on for local health activists and health professionals about how to care for street-level care. So that's really unfortunate for us.
Why?
We were afraid that people would be arrested at our clinic space, at our wellness space. We put it to the people in our training, a lot of whom have their licenses on the line to provide free health care, and they were fearful that they would be arrested and put in jail, at least holding for 36 hours before being let out.
So tell us about the clinic.
So our wellness center has kind of 2 modalities. One is complementary and alternative health care that's focused on mental and emotional health and creating kind of a calm and chaos sense. And then the side I'm more engaged with is more what you'd think of as standard health services. So looking at the particular needs of our crowd, we thought we would have a strong need for exposures and decontaminations from being outside. So we have facilities so people can get washed off, get spare clothes, as well as facilities to bandage basic abrasions and wounds. Mostly we're just there to lend an ear and give people reassurance and refer them if there's any serious illnesses to providers that we feel comfortable working with.
From Minneapolis, I'm Don DeBar.